Be live.
You should be live.
I should be live. Says I'm live for 5 seconds now.
Live in 5 seconds. I'm going to look for you.
And I need to do an overlay that has my new channel. I got a permission to do a custom URL for this channel. So
Yep, you are live for sure.
Good. And so I need to do a little overlay that's got that. So if anybody on your side has a particular question that they just want to ask me directly, they'll know how to do it.
Okay, that's fantastic. We are live. I have 31 lovelies flying on already. They've just been got some. Loads of people are actually with us and doing this. Yay! Hello, Kira. Hi, Vanessa. Hi, V. Hi, Deborah. Debs. Sorry, I'm reading.
Debs. All right.
Debs is on. Mary Beth. Anne's on. Terry's on. Deborah's on. Leanne. Hello, Leanne. You might have seen a bit of your guitar box earlier. Wink was playing it, but he only gave us a little.
It's not finished.
And it's not finished yet. Sandy, hi. Kay Kin, Van Flirt, Sal in Glasgow. Yeah, she's a late night bird like me. Fabulous. Caroline Christine, hi. Hi, Kelly. Wow, they are flying on. We have 38 now, which is fantastic. Hey, Kelly, how you doing?
I think I got one.
You got one. Oh.
Well, I just changed the URL to the channel, so I'm afraid that it may not be going through. I got one.
I've got you.
Got Adam.
I've got you live. Let me just flick on you and turn it down. And I'll just stick on here so I can make comments on here. We're just getting organised, folks. As you can see, we are 4 minutes early. Oh, wow, 41. Fantastic. You are just amazing.
I don't know if I'm live. I'm going to have to check my channel here.
You are live. It says you've got one person, which I guess is me.
No, because I would have more than that because I have somebody else that's not you. So that's not right.
But this is delayed by 30 seconds, isn't it? So you've got 47. They are absolutely flying in. Hi, Angie. Hi, Lynn. Hi, Chrissy. Hi, Shonda. Hi, Kelly. Hi, Evelyn. Yay!
Okay. Yep. I'm live. I'm just not.
Wink, she thought it sounded fabulous.
I got two. I'm just not popular.
Yeah. Oh, you are popular. No. They all love you. They know I'm coming on with you. So
I know. It's my only chance to get an audience for this nonsense tonight.
Glad I can be of help.
Oh, yeah, I'll take it any way I can get it, right?
Yeah.
Well, while I'm waiting for a few more people, I had a really amazing cyst today on the anterior neck of a patient. He came in as a new patient. He had seen our YouTube videos and he said, "Help me." And I said, "Okay, we'll take a look." And sure enough, he had two really impressive cysts. One was on the left forearm. Hey, I got another one. I'm up to 4. Yay, 4.
Yay.
And he had one on the neck, and I was pointing out, it's just like right over here on the right side. It's like inverted everything on here. But anyway, hi, Vanessa. But we removed it, and I sent it off to my editor, and I said, this is probably one of the best cysts we've had in months. And so I expect it'll be online pretty soon. Oh, you're on both channels. Oh, that's cool, Vanessa. Yeah, I just have to have 2 devices. You can see us both.
Yeah,
thank you, Terry.
And they can see and hear you.
And I put a little line underneath that has where to go if they want to come on mine. I'm not trying to steal your viewers. I just want, for those individuals who may have a medical question, who just want to ask me and don't want to, run it through you having to repeat it, they can do that and then go back onto your channel. I don't have a problem with that. This is us working together to help people, and it's not I'm just happy to be able to have an audience of people who are interested in being healthier and doing what we're doing, and I realize fasting is difficult and people have questions, and that's fine. Let me see. I got Adam here headed to the airport. Wanted to say hello. Have been using Cocoa Skin Plus. Been great for your hair. Thanks. You are welcome. Fantastic. Fantastic. Okay, so we got more. We got Debs, we got Christine, got Maureen, and Mary Jane. Hey, Mary Jane. Hello, everyone. So, okay. So it's picked up a little bit over here. So,
Hi, Sharon. They're really looking forward to your video, they're saying. I've got lots of comments about your video that they're looking forward to.
I've got it here and it's ready to go, and it's the Baby Gonzo with the Ginger Snap twins. So I'm pretty excited.
I know you'd all like to see that. I know they'd all
I
like
asked him if he wanted some whiskey and he didn't answer, so I took that as a no. I mean, yeah.
Probably not into his whiskey by now, I shouldn't imagine. It's like I'm obviously a princess because I'm sitting on something on my sofa, which is not very comfortable.
Okay, I got a quick question here from Vanessa. What do I suggest for superficial thrombophlebitis? You have a clot from your wrist to your elbow. Okay, absolutely 100% you need to be on an antiplatelet agent. Secondarily, though, you need to be on steroids, corticosteroids, such as prednisone or dexamethasone. You're going to have a hard time getting this under control without being on steroids. I've had patients deal with significant thrombophlebitis in the past, and let me tell you, it's no fun. It's painful. And the way that you get the inflammation down is use corticosteroids, and then you consider why this happened in the first place. A lot of times it is dietary. Okay, so I hope that helps, Vanessa. Let's see. There we go. You didn't get a notice that I was live. I think that's what's happened. So I was able to get a custom address for my vignettes channel. So that is undergoing a process on YouTube where that's being changed. So it's up on there instead of the whole series of numbers and so forth. I now have the youtube.com/C, which is custom, I think, / John Gilmore MD vignettes all run together.
It's showing on my screen, so they can't see it on my channel. So I'm going to have to put that up. So bear with me while I copy it out.
They don't see that? They don't see the little things that I have on my channel?
No.
Up in the upper left corner as I'm looking at the screen, I've got a little Meta 7 kind of pretty orange, and then below it on the very bottom I've got youtube.com/C/ John Gilmore MD vignettes.
No, that isn't showing on my channel. Well, wow, we have 70 people online now.
That is not acceptable. YouTube, shame on you. All right, I'm going to go over and I'm going to get a look-see too.
While you're looking, I've got a question for you from Stephanie. What is Thermain symptom of pancreatitis? I'm rubbish at this, aren't I? Pancreatitis, staying nauseated, pain after I eat, off and on all day. Okay, I just checked. You're right. You are delayed. Sorry, I was reading that. So, maybe it'll come on then. Let me try this. Maybe it'll come on. How long has your banner been up? It's been up long enough, and I just moved it over to your side to see if that, but I doubt it shows. No, it doesn't. Let me just type it in. YouTube. You know what I can do is I can Skype it over to you. .com. Oh, it's on my side now. Can you see it? Well, there's a delay. Let's see if it comes up on my side. I'm just going to type it in, though, because people are asking for a link. All right. Gosh. I also just Skyped it over to you as well. Okay. Hey, Sherry. Gilmore, hey, MD, Darla. Isn't it MD? Okay, I want to get back to Vanessa real quick. With the thrombophlebitis, yes, very painful. You got it from an IV. That happens. I got one after my IV when I was in the hospital. It went from the antecubital fossa all the way up and came across right here to my chest. And it took about 6 weeks to go away completely. And the fact that I was on high-dose dexamethasone helped. It made me very angry, though, and hungry. Part of it. Hangry, that's called. Hang on a minute. Hangry. I was hangry. Oh, hang on, I'm trying to get down to this. Leanne said she had pancreatitis. to do with a supplement she was taking, and it messed up her sugar because the pancreas is responsible for making insulin. I didn't have any nausea, but had extreme cramping. So that's just another one on that topic.
Interesting. Yeah, pancreatitis is a very serious problem.
Get me a mug.
No,
Sweetheart. That's Wink's going to
Okay,
bed.
Wink.
Hi,
Hi,
Dog.
Wink.
I'm leaving the wrong way. There we go. I'm in the kitchen now. You all right?
Hey, Wink, are you going to get a few days off? Now, do you all celebrate Thanksgiving or no?
No.
No, we don't.
That's a great holiday. I think that you should join the United States so that you get to have Thanksgiving. All right. So,
Holidays. Yeah. Holidays are good.
hey, I'm open for a union either way. I think we could join you too. I think it'd be great to have a queen or king. I mean, I'm starting to think that anything could be better than what we've got right now. I think your government's just as dysfunctional as ours. So I don't think we could go wrong either way, guys.
No, I don't think so. Kelly's saying goodnight to you, Wink.
All right.
So's Denise. Night, sweetheart. I will see you in a few hours, no doubt, or won't because you'll be asleep.
Okay, so I'm getting some people saying they're seeing it in my channel, so maybe it is a delay. So
I can see your orange banner.
Okay, and
Yes, they can.
do you
I
see?
can see it on my side now.
Okay, so I dragged it over there,
Yeah, it's on there now.
and that's
Can
not
everyone...
not to steal away your viewers. I'm not intending to do that. I just want to, just so if anybody has a question they just want to ask me and just want to type it over here, they can come over and then they go right back over to your side. Let's see, what was the first med I said? Yeah, yours is up to the armpit. So you've got significant thrombophlebitis, which is an inflammatory condition that leads secondarily to a blood clot. It is a superficial problem. There is very little to no risk of that breaking loose and becoming what we call a deep venous thrombosis, which is a much more serious condition. Superficial thrombophlebitis is very painful, and it's an inflammatory condition. And generally, once it happens, the best way to get it under control is to be on corticosteroids like prednisone or dexamethasone. Methylprednisolone is usually not strong enough. Usually it requires dexamethasone or prednisone, okay? And we're talking about weeks and weeks of medicine here. We're not talking about a short, 7-day thing. That's not enough to get this under control. Naturally, you can take turmeric and curcumin. That can help. Omega-3s can be helpful, like flaxseed oil or fish oil. I prefer the flaxseed oil. I think it's a safer product, better product. But once you get this under control, you need to address your underlying inflammatory process and why this is happening to you, okay? So there you go. Hope that helps. And so it looks like people are getting the little address. If they want to come over and ask me a question, they're certainly welcome to. So we are fasting. I'm going to hold off on Baby Gonzo.
Who's all fasting?
Me.
Me.
Are you fasting today? Good for you.
Yeah, I am. I'm on my second fast, and I've only been hungry for a little bit once today, but only literally. I just stopped thinking about it, and it kind of went away.
All right, good.
So, and I'm literally so full of energy today. I'm just like, I've just been on my Facebook page, just like flying off the bed, almost excitement beyond all measure. So that's really, really good. So I had a question about fasting actually, because I have not been exercising since July, and I want to start kind of going at it again. And what about exercise and fasting?
Okay, if you're fasting for 1 day at a time, if you're doing intermittent fasting, let's say you're sticking with the Monday, Thursday, you can do whatever you want on those days, and you do not need to adjust anything. Nothing.
Right.
You don't need to adjust. The only people that need to make adjustments are people that are that are type 2 diabetics that are on insulin. They will need to be prepared to reduce their insulin doses. Okay? That's all right, Maureen. Don't worry about it. If you can't fast because of medication, we understand. You don't have to fast to be healthy. It's an accelerator. All right, we got Debs and Lee are fasting, so that's awesome. Good to see you, Lee.
Right, I have another question. I think this is from Leanne. I think this is to do with pancreatitis.
Pancreatitis. Okay.
Pancreatitis. She said she had tightness down her stomach, like the symptoms of somebody else who I already said. And she said, sounds more like gallbladder issues, but it could be because it was a combination of both. And to see what you had to say, that's probably really confusing, and you probably have no idea what I'm talking about.
Actually, I think I got you. I think what they're looking for is a cause for the pancreatitis. Okay. Known causes of pancreatitis. Number one, biliary. That means a gallbladder problem or gallbladder common bile duct or something wrong with the way bile is handled in the liver. Okay, so number one is biliary. Almost always it's gallbladder disease, but it can be a sign of a tumor or other problems in the bile duct system or a stricture or tightness. So number one is biliary. Number two cause of pancreatitis is alcohol use. A lot of alcohol use causes pancreatitis. Very common. It's probably the number two cause. Number three are medications. Some drugs can cause pancreatitis directly. They can also lead to biliary problems. For example, estrogens slow down the flow of bile through the bile ducts, and so that can be an issue there. Scorpion stings can do it. Elevated super high triglycerides can do it. Hypertriglyceridemia. Trauma, getting injured in the abdominal area, and then finally, idiopathic. We don't know. So those would be the top 7 that I'm aware of. So when we have a case of pancreatitis, we need to find out why. If we can take care of the reason why, then we usually can correct the pancreatitis. Pancreatitis is very, very potentially dangerous. Okay, so I answered that. You got the next one. I'm going to read through and see because I got some questions.
Oh,
Hey.
Oh, that's the phone. Right, okay. So Leanne said she accidentally slipped over and hoovered up a turkey sandwich, and she threw it up.
Thanks.
I think that's your body saying it doesn't want, because you've been eating really healthily. Somebody has asked about when changing to... Right, could I please ask you, if you have a question, can you do it in capitals? Because it makes it easy for me to find it. When changing to vegan, how long will it take before my poor bowels calm down? And Beverly that's Stephanie. How long would it take for bowels to calm down when changing to vegan?
Okay, so that's a different answer for different people. Some people have irritable bowel problems anyway. For most of us, it's about a 6 to 8 week period. So you just have to be patient, and things will get to normal. Stick with it, and it happens. But you're looking at probably a 6 to 8 week period before things start feeling healthier and better. And what happens over time as you make that switch from animal products over to whole food plant-based products, the flora, your bacteria that live in your gut actually begin to change. So you get healthier species that begin to thrive, that live off of carbohydrates and off of plants, as opposed to those that produce the poisons that live off of animal products, okay? And so as a result, your gut goes through a series of changes, and your stools will change, and you'll get healthier through it. But you have to be patient for the transition. You may get some gas, you may get some diarrhea and things like that. So that's my answer for that.
Okay, I've got another question for you. Can I ask you what can Jacqueline do with severe pain in every joint due to osteoarthritis? Also, I can go whole days without passing water.
Okay, so that's a problem. Going an entire day without going to going number one, we'll just say, indicates that we might have a problem. Does she get frequent urinary tract infections?
Can you answer that, Jacqueline? Do you get frequent urinary tract infections? Plant-based is going to help osteoarthritis.
A little bit, but so will turmeric. Osteoarthritis is not just an inflammatory process. It is a wear and tear process. As we get older and we've used our joints for decades, we wear them out, we wear them down. So most osteoarthritis is nothing more than a wear and tear and then a secondary inflammatory process that occurs. So eating whole food plant-based helps protect the joints, because eating a animal product-based diet actually increases the inflammation in your body. So whole food plant-based helps. Also, we have natural anti-inflammatory products, those that are high in omega-3s. You can get vegetables that are higher in omega-3s, or you can supplement with flaxseed oil, or flax seeds, or flaxseed oil if you want, but you can just get flaxseed and you can add that to your cooking or to your food. It's not unusual for me to make like a lentil soup and then add a scoop of flaxseed right in there. I love that. Plus, I take the turmeric curcumin supplement that I have on my Meta7 site, so that can help. But look, if you have advanced osteoarthritis and you're dealing with stiff, tight joints, one of the best things that you can take is Tylenol or acetaminophen, whatever you call it, wherever you are. It's very, very effective at increasing mobility, decreasing stiffness, and swelling. It doesn't help very much with the pain, though. So if you're looking for a medical answer, that's when we come back and we start adding. If that doesn't work with the Tylenol from a medicine standpoint, that's when we come back and we add the anti-inflammatory medicines, which if you're whole food plant-based, you're not going to need as much of, because you're going to have less inflammation to begin with. So if you do need to add something, Aleve is a good choice, which is naproxen. There's lots of prescription medicines that are generic now, like meloxicam. Ibuprofen is the gold standard anti-inflammatory, but for a lot of people it causes GI upset. It upsets the stomach and esophagus. So if you have a history of gastroesophageal reflux disease, gastritis, or those kinds of things, you want to stay away from ibuprofen. So see your doctor if you need something more than Tylenol, but certainly consider whole food plant-based eating as a lifestyle change, and consider turmeric curcumin.
And yes, she does have frequent urinary tract infections, and she's got one now.
Okay, so that answers the question that I was looking for. She has a stricture somewhere in her urinary tract, most likely in the urethra. So she's not easily passing urine, and as a result of that, she's getting frequent urinary tract infections. This is something she needs to see a urologist. And a urologist can do a test it's called a voided cystourethrogram. It sounds really uncomfortable, and it probably is, but basically they put you in the stirrups. Wow, this is really rough stuff, guys. They put you in the stirrup. They do the same thing to men. This is not just for women, but they get you in the position, and they will actually use a little lidocaine jelly to numb the urethra, and they will take a catheter and slip it into the bladder, and they will fill the bladder with saline, and they'll measure with an ultrasound the amount of fluid in the bladder to begin with. Then they'll ask you to go void and actually go use the bathroom and void that saline out, and then they'll put you back up on the stirrups, and they'll use an ultrasound to measure what's left over. If you have a stricture or a tightened area in the urethra, you will not be able to properly empty your bladder, and as a result, you need to have a procedure where they'll dilate the stricture and they'll fix this problem. Normal people who are drinking plenty of fluids during the day should use the bathroom, should be voiding every hour and a half to 2 hours at a minimum. If you're not going that often, you probably have a problem, okay? So
she says thank you very much.
She's welcome. I'm worried about that because that backing up of the urine can go all the way into the kidneys and lead to kidney problems. I'm way
She's
behind.
She's anti-inflammatory, she says as well.
Okay, so anti-inflammatories. Can I answer a quick one here from Sherry Austin?
Yes.
Your 15-year-old wants to go to a whole food plant-based diet. Are you asking me if that's okay? The answer is yes, absolutely. There's nothing wrong with that.
Fabulous.
So you got the next one. Go ahead.
Fabulous. Beverly says she does. She goes to does a lot of swimming in a lovely warm heated swimming pool, and it really helps her osteoarthritis and pain in her joints.
Okay.
There would be no pressure on that as well.
Here's one from Ann Capizzi. Dr. G, you wrongly assumed I had stretched my stomach post-sleeve. I have had scans and tests that show the stomach has not stretched at all, yet still cannot lose weight. Well, it's terribly uncommon, let's just say, that post-sleeve gastrectomy that the stomach does not stretch. In fact, I don't know of any cases where it has not. So I'm really concerned that your tests are showing if you can eat a full meal, then your stomach will have stretched. When you first have a gastric sleeve, it's almost impossible to have more than just a few bites of food at a time. And over the next few years, the stomach does stretch back out. So I'm not sure what information you're looking at, and I'm not sure why you can't lose weight, but I can tell you that if your thyroid is normal, you're not losing weight because you're getting too many calories. And that's a biological fact. I know a lot of people think that it's hormonal, and sometimes it is. There can be some hormonal issues. It's almost always thyroid. If I wrongly assumed that your gastric sleeve had stretched back out, then you have my apologies. But I will tell you, as a physician, as a clinician, I have lots and lots of post-sleeve patients that are 4 or 5 years out, that are gaining the weight back. They can't lose it. And the reason is now they're able to consume, the high amount of calories, and they're on cheap calories, again. So we'll leave it at that. It is not my, purpose here to question anybody's integrity. So if I came across that way, I apologize. That's not my purpose. Let me go down here. Sue, do you have something?
I have somebody talking about pneumonia.
Is it
She's had
Stephanie?
several cases of. Sorry?
Is it Stephanie?
No, it's Core. She's had
Okay.
several cases of pneumonia from household member bringing it home and having trouble moving. She's had shot number 1.
Okay.
Pneumonia vaccine, but won't give her Prevnar 13. Does
Okay.
that sound right?
Okay, so it's just the opposite here. Our recommendations are at age 65 and sooner for upper respiratory problems that you begin with the Prevnar 13 at age 65, and then at age 66
She's
you
not
get the
65 yet. I think that's
okay.
what she said.
If she's having recurrent bacterial pneumonia, and let's be very clear, folks, 50% of pneumonia is viral, all right? 50% of the time that you are diagnosed with pneumonia, it will be viral. The remaining 50%, only half of that is strep. In other words, only half of bacterial pneumonia will be prevented with the shots. So you still have the other 75%. So half of all of it's viral, the other half is strep and will be prevented with the pneumococcal vaccines. Strep pneumoniae, pneumococcus, is what the vaccine is. It's pneumococcal vaccine, so it's streptococcal or strep pneumoniae, okay? That's the name of the organism. You have all kinds of other kinds of bacterial pneumonia that can occur, but that's 25% of all pneumonias, 50% again being viral. So if you're being exposed to a lot of viruses and getting pneumonia, and yet you're worried about these vaccines, remember the Prevnar 13 is not nearly as broad a spectrum of preventing just this 25% of pneumonia. If you have a problem with viruses in general, you may need to see an immunologist and get tested to make sure that you don't have an IgA deficiency, which is a kind of immune deficiency that can be causing multiple bouts of pneumonia. You're up again.
Right.
Or was that your question?
Sal has asked me to look for her comment. I'll look for it when in a minute.
Okay, I have one from Stephanie. She asked about the symptoms of pancreatitis. Basically, it's nausea and a lot of abdominal pain and cramping. Look, it's an easy diagnosis to make. You just go see your primary care doctor. They can draw a blood test and tell you whether you have pancreatitis or not. You can have it back in a few hours probably if you go to an emergency department of some kind. So if you're having a lot of abdominal pain, don't ignore this. You need to see your doctor. You probably need, here in my clinic, if you come in and I had one, maybe two today that came in with abdominal pain, and I see lots of people have pain. That generates for me an automatic blood count and platelets, a metabolic panel. It generates an amylase, a lipase, and for sure an ultrasound of the abdomen and possibly a CT scan of the abdomen and pelvis depending on my exam. Go, Sue, you're up.
Right. Sal has asked, she's on 50 milligrams daily for panic attacks and was having really bad leg trembles. Then her GP halved the dose and the panic attacks returned, so put her back on 50 milligrams and the leg trembles have started again.
15 milligrams of what medicine?
50.
50 of what?
Oh, right. Sal, can you let me know what medicine you're on? Sal's in Glasgow, by the way.
I think, do I have a list of her medicines? Let me just check. I don't know if I do or don't. No,
Sal,
I don't.
okay.
I don't. Sal, if you can hear me, if you'll email me a list of your medicines, I can be more of help to you. As long as you don't mind me keeping a list of your medicines. I won't share them.
Okay, I'm going to stick his email up for you. It's John Gilmore MD at mac.com.
You got it.
I've of course mistyped it, but I've said it right. MD, and I've got a space in there. Right, I do have another question for you.
Well, I just realized we're 30 minutes into this and we haven't done the first benefit of fasting. So while you've got that, I want to tell the first benefit of intermittent fasting is increased metabolism. Your metabolic rate will increase. So that's number one. I'm going to give you a list of these as we go, and I'm going to check them off. Okay, you're up. Go.
Okay.
I believe if we don't prioritize them, we're not going to get them out there. I want to get them out there.
That's right. We're going to spend 3 hours talking about injections. So that increased metabolism means that we're going to be burning off more excess fat and getting slimmer. Is that correct?
Yes.
Yo! Because I know a lot of you want to lose weight. I've got Chrissy here. She's 40 years old and overweight. She had a heart attack out of nowhere in June, and she found out she had CHF. I don't know what that is.
Congestive heart failure.
Now, scared to death. Is there any way to reverse this?
The answer is we can definitely manage congestive heart failure. It is a battle between what the heart can do and what the kidneys want. So it's a fluid management issue. If you have damage to the heart, there's an old saying in medicine, dead meat don't beat. So if you have had an infarct, if you have had a true heart attack where you have had heart tissue that has died, that will form a scar tissue and it will no longer function normally. And this can be seen on EKGs and echocardiograms. What's important is how much damage was done to the heart. Usually they'll give you a percentage as to this percentage of the heart was damaged and is not expected to recover.
Right, Chrissy, I suggest you email Dr. Gilmore. I've just put the email address a little bit further down from your question. Okay, Anne, this is an interesting one. Not that others aren't interesting, but Anne says she's anemic normally, very low, and my doctor recommended eating red meat 3 times a week. I eat a lot of leafy green veg.
There's no medical reason ever to eat red meat.
Okay, you heard it here, Anne.
There's no, that's ridiculous.
Lots of green vegetables, lots of brassicas.
If you have a true protein deficiency, and I've been practicing medicine in the United States and Texas for 25 years, and I have never, not once, had a patient with a protein deficiency, even those who have undergone gastric bypass, gastric sleeve, and other procedures. Okay, but if maybe you are the one, if you need to be supplemented with protein, get yourself a vegetarian protein. Sue talks about the fact that she makes herself a protein shake from time to time as a meal replacement, so she can tell you about her vegan protein that she uses.
Yeah, I have a vegan protein shake. It's made of pea, cranberry and rice protein, so it's completely plant-based. It's packed full of vitamins and nutrients, all the daily RDAs. It's very easy to digest, and it is literally, I put some nut milk in, 2 scoops, whiz it up, neck it. And it's like, it's my lazy food when I know that I'm doing something really good for my body, but I haven't got time to chop things or, you know, think about what I'm going to make. It's my kind of go-to thing. And that's, I think it's 20 grams of protein, which is the most protein you can digest in one meal. A lot of, the protein powders that make protein shakes you can make smoothies with, they have more than 20 grams of protein in it. And that is because they have other ingredients like whey in it, which makes it, because that's so difficult for the body to digest, it can't grab all the protein. So they need to whack more protein in there so that you can get the 20 grams out of their 40 grams. So it's a really, really good, protein shake. And I also have, another supplement I use, which is it's just a protein boost. So it's 10 grams of protein, it's 10 grams of fiber, and some other things that I can't remember off the top of my head. And that's sometimes I'll put that in, you know, something I'm making just to add some more protein to it. But, you know, really if you're eating a well balanced, you know, plant-based diet, you'll be getting all the protein and all the things that your body needs. It's what we were designed to eat.
Exactly.
But I can understand when you're moving to a plant-based diet, it can be very bewildering. I'm not quite sure what I can eat anymore because we are so used to adding cheese, adding eggs, you know, having some chicken thrown in with our stir fries and eating stews in the winter and stuff like that. It can be difficult to know what to eat because you just think, well, what am I going to eat? I can't just have a plate of vegetables. There's loads and loads of fabulous things you can add. Quinoa is fantastic. You know, super seeds you can add. There's fabulous. If you eat seasonally, this is a tip. Okay. Look what is seasonal. And I know that's very hard because we have strawberries 365 days of the year. They're grown, you know, GMO in polytunnels. Okay. You can look it up on Google. What is seasonal in November? What is coming out of the ground in November? You see, we're natural creatures. We're animals. I know it's really hard to forget that while we're here Skyping live on 2 channels and talking to hundreds of people all at once. But we're animals. Okay. And we're on this planet and carrots come out of the ground this time of year. So it's really good to eat carrots because they're fresh. You know, and they're ready to be eaten now. You know, when you look at animals, you know, fruit eating animals, they eat the fruits that are there and then they eat nuts and then they forage at different things that are available in different times of year. So if you're eating seasonal vegetables, you're doing yourself a lot of favors. There'll be less miles on it. There'll be less messing around going with the raw ingredients. So, and eat the rainbow. We've said that before. Get as many different color vegetables on your plate as you possibly can.
Absolutely. Okay, can I take over real quick? I have 3 things. One, somebody asked me if I was going to fast for 48 hours. No, I'm going to fast for 3 days. So I ate something Sunday evening. Yesterday evening, I'm not going to eat again until Thursday morning, the Thanksgiving day. So I'm doing a full 3-day fast. Because I kind of got off track with my fasting and I feel like I consumed too many starches over the weekend. So I'm going to throw in an extra day since I'm already doing Monday and Wednesday again this week because of our holiday. I figured I would go ahead and just do 3 days. So I'll do that, let you know how I'm going. Number 2, the second good thing about fasting is it improves blood pressure. It helps reduce blood pressure. Okay, so that's number 2. Number 3, I wanted to talk about Ann again because she said she can't eat a full meal and her thyroid is not normal and she can't eat more than a few forkful as she has a hiatus hernia and I don't know what a dancing esophagus is. But Ann, if your thyroid is not normal, you're going to have a hard time getting a normal weight. I recommend natural thyroid products, usually by Armour, and there's another company called NatureThyroid, but I think Armour is about the best, ARMOUR. You need to get your doctor to put you on thyroid twice a day. The once daily synthetics don't work well for some people, especially younger people. I like the Synthroid or synthetic products for my elderly patients. But for those of us who are a bit younger, an Armour thyroid twice a day until your TSH is down around 1, 1.0, 1.5, somewhere in there, you're probably not getting your thyroid. So I would definitely check on that. Don't beat yourself up. And here's another thing, and this may not be your case, but for others out there who have trouble keeping the weight off, and it's a big problem. A lot of times, if you've had a sleeve or you've had a bypass, a lot of people can learn to overcome that. They used to wire people's jaws shut, and they stopped doing that because every now and then somebody would vomit and aspirate and they would die. But even those persons learned to drink plenty of milkshakes and things like that, and they were able to overcome that obstruction to help satisfy their craving for foods. This is part of the reason why I fast. I have the same problem. I like to eat, and I know I like to eat, and I will balloon back up fast. So for me, fasting is a way for me to keep my food addiction under control. Okay, back to you, Sue.
Okay. Right, I've got one from Sharon. She's on warfarin, and her doctors have said she cannot ingest any natural oils, turmeric, hemp oil, etc. Is this true?
No, it's not true.
There you go. It's not true.
It's absolutely not true. Get another opinion.
Okay.
The only thing that you have to watch out for when you're on warfarin is vitamin K. Anything with vitamin K in it. So green leafy vegetables can be a problem. When we as physicians are managing patients on warfarin, we need you to do one thing really important. We need you to be consistent with your diet. We can work around whatever you're doing if you'll be consistent with it. We can adjust the dose of your Coumadin around that. So if you're going to eat about the same thing on a regular basis, we can adjust your Coumadin to where you don't have to keep changing the dose every time, okay? I see cardiologists that have their patients in every week to 2 weeks to get a blood test. I have lots of patients that I manage on Coumadin. Once I get them adjusted to a proper dose, they only have to come in once a month, and only rarely do I have to adjust the dose from there. And that usually happens when somebody tells me they've changed their diet or they've done something significantly different, and then we have to make another adjustment. And again, as long as they stick with whatever change they've made, I don't have to keep checking them that often, okay? So keep that in mind. But oils, no, absolutely not. What were the other items on the list? Besides,
turmeric.
Turmeric is fine. If you're going to have turmeric, do it on a regular basis. Let your doctor know. They can adjust around that.
Okay, and hemp oil, that'd be another natural oil.
Same thing.
Same thing. Yeah, they were the things she listed.
These plant-based oils should only be used sparingly. If you're on Coumadin, let your doctor know. There's no reason you can't have. I'm sure they're telling you that you can have steak. I'm sure they're telling you that you can have pork chops, and those are loaded with oils too. Okay, so I have lots of patients that are on Coumadin that are on vitamins. If they'll tell me they're on vitamins, I can help them adjust their Coumadin around that. Okay, the only culprit is vitamin K. Okay, that's the one we have to be careful with, and we find lots of vitamin K in the green leafy vegetables. And so we want to be very consistent with the amount of vitamin K that we're taking so that our doctors can adjust around that with the dose of the Coumadin. I hope that helps.
Right, yeah, I think that's helped. I've got Beverly's been drinking a lot of V8. Is that okay?
Well,
isn't that a charity drink or something?
It's a vegetable drink, and it's really quite tasty. The only problem with V8 is it's loaded. The regular V8 is loaded with sodium. That's why it tastes so great. You have to be careful that you don't get too much sodium. They make a low sodium version of V8, which is a vegetable juice thing, which I think is just fine. It doesn't taste anywhere near as good because it doesn't have all the salt in it. All right?
Yeah.
So it would not count as a whole food. It's not. It is plant-based, but it's not a whole food. But it's not terrible either, okay? So if you're going to drink some V8 and you want a small glass of V8, make sure you get the low sodium version so that you don't overload your body with lots of sodium.
Excellent. So what happens to your body when you reduce your blood pressure?
Well, in
'Cause you said
general,
it was benefits.
in general, those of us that are on a whole food plant-based diet, we no longer have blood pressure problems unless we're saltaholics. Okay, so what happens is your blood pressure comes down to normal.
Whoa!
There's nothing wrong with normal. That's what happens to your body when you get off animal products. The next thing on the list, your triglycerides and cholesterol numbers will plummet. They'll come way down if you're on if you do intermittent fasting. That's number 3 on my list of things to tell you about.
Okay, tell me what are triglycerides and the other word that I can't say, because I don't know what they are. It's all gobbledygook to me.
Cholesterol?
Triglycerides.
Triglycerides are non-specific fat in the blood.
Oh, we don't want that. That doesn't sound good for the heart.
We don't, because that can lead to an increased risk of stroke, heart attack, and blood clots, as well as elevated super high levels of triglycerides can cause that pancreatitis that we were talking about earlier.
Right. Okay. So absolutely good for the heart then, all over.
Absolutely good for the circulatory system.
Everybody's saying that we're doing a great job and they appreciate it. I seem to have whizzed up. How long does it take for the flu shot to kick in?
Just a few days. Usually I think within 72 hours. It may take as long as 5 days in some people. I have a question from Pam. Dr. G, when you fast, what do you eat or drink? I don't eat anything. Fasting is not eating. It means no calories. That's what fasting is. 0 calories. You drink all the water that you want. I will occasionally have a 0 calorie. This is Coke Zero. Zero. There are no sugars. There are no calories in this beverage. I like to have one a day. I've been very open about it. I realize it's not a whole food either, but it's my vice. I like it. So, I do not eat food when I fast, and I do not wait until midnight and then have a snack. You just don't eat. You wake up, you have your day, and you go to bed, and at no time during that day do you consume calories. If I have coffee, I'll put a little Splenda, a 0 calorie in it. But I do have coffee, I do have tea, and I do have water, and I occasionally, I'll have my Coke Zero. It's my weakness, I admit it. Okay, next thing good about intermittent fasting. It reduces symptoms of depression.
Yes! Because I know it's a pandemic depression, isn't it?
Yes,
Everybody's like, it's just everywhere. So that has got to be, if you're depressed, it kind of stops everything, really. Mm-hmm. It just sucks the joy out of everything that you do. There's that niggling at the back of your head, just not quite got any sparkle, not quite got any enthusiasm, even things that you really like. Mm-hmm. You can't be bothered with. You can't be bothered with yourself. You can't be bothered to eat right. You can't be bothered to wash. You can't be bothered to clean your teeth. You can't be bothered to do anything. You don't go out. Your life becomes smaller and smaller, and you just get more and more inside your own head, and your own head just destroys you. So if we can, it's absolutely, because your gut will be working. Here I go about the gut. That's my big thing. Your gut is working better. It can produce more serotonin, and that's going to be going into your head, and that's our happy drug. That's the thing that people drink alcohol for and take drugs for.
90% of your serotonin receptors are in your gut. They're down here. They're not up here.
Yeah.
That's
it's
a fact.
Made in your gut. Made in your gut. Get your gut working right, and your depression will just have all happy things. Will just be dripping. Your spirits will lift, and your energy will lift, and your life will just open up. It's just like magic. Look after what you put in your gut and get that working real good. So absolutely, it's just like, it's my big thing I've been jumping on about for 4 years to people. And, people don't want to hear, because they want to have their Big Mac, and, they want to drink their 10 pints of beer or whatever it is they want to do. Or just eat pies or have their biscuits or their favorite things. I got a question and I can't find where it is. Why is it so hard to give up sugar? To you. Why is it so hard to give up sugar? Apart from the fact our taste buds are programmed to like fat, to like salt, and to like sugar. That's kind of in us.
I think you're right. I don't, I think everybody's different. I crave fats. I crave, I miss cheese. I think there are some people that, they like their sugar, and sugar is a drug. Alcohol is a drug. Those are two very common, calorie sources that we seem to be, develop addictions to quickly. There's all kinds of forms of food allergy that's out there. So, everybody has their own particular predilection to what they crave, and what their problem foods are. But almost all of us that live in Western societies, we're addicted to, cheap calories. Unless you're a whole food plant-based eater and you've already made the transition and you've beaten it. And I can tell you that after 9 months of whole food plant-based eating, I have not beaten it. And I still will overeat if given the opportunity. So I'm very careful to eat purposefully and not just eat because food is available. I also do the intermittent fasting because it helps me stay on top of the food addiction. And we talked about this before. There are all kinds of addictions out there, everything from nicotine to whatever. You can quit all of them, but you can't quit eating. And that makes food addiction a very, very difficult problem for a lot of us. We have to learn to manage this addiction because we can't eliminate it. And that's a fact.
And also, just to add about sugar, when you eat processed refined sugars, okay, which is in your ready meals and all your packet food and all of that sort of stuff, it spikes, your blood goes up, and then you crash down again. And so you want another biscuit, you want another source of sugar. So you do this spike run all day long. And so your body craves what you've had before because it's run out of that high. And we've talked last time about healthy sugars to eat. There's stevia. Is it Splenda you said is okay?
I like Splenda because it's sucralose. It's actually a natural sugar that's non-calorie.
There you go. And also there's raw sugar cane. That's a natural product. Our body knows what to do with it. What it doesn't know what to do with is all this aspartame and all this, all these kind of corn syrups and all of that processed stuff plays havoc with our digestive system. And also, pick a fruit. There's loads of fruit is so sweet. Bananas are sweet. A lot of recipes call for bananas instead of sugar for cakes and stuff like that. So, have something that's naturally sweet, that's a natural product, just to get that hit of, sweetness. But if you take out your processed sugars, you will have less problem doing without them, because your body your blood levels won't be spiking and just making you crave them. So I think that will really help. I've got a question, going back to one of the benefits of fasting, which I just wanted to mention. Right, something diffigratin. I haven't got a proper name, but that's the handle on it. Recently had her blood panel done and her cholesterol is too low. Is that a legit thing? Is it something to worry about?
Well, I need the numbers. I need to know what the cholesterol level was.
Okay, can you stick that in the comments and we'll answer that one? Can you put it in capitals for me as well so I can spot it? Thanks. Somebody's put something. Poor Dr. G works all day as a doctor and then comes home and is our second doctor. She says she thinks you've got tired of talking medicine. I'm sure.
Hey, I'm doing it for you guys. Ordinarily, this would be downtime for me, but I'm so excited about using this venue as an opportunity to help people when I don't have this time. I've got 20 some odd people here, and I don't know how many are on your channel. It doesn't matter, but here's an opportunity to make my time much more valuable. I mean, I don't have this luxury when I'm sitting with a patient in a room for 7 minutes or 8 minutes. I just don't. But here's an opportunity to really talk about things that'll make us healthier and give people, real straight up answers to their questions whenever possible. I'm honored to be able to do this. I think this is a fantastic opportunity, and I'm glad you guys are participating, because for a lot of people, these are pretty dry subjects. It's just not that exciting. I can put up a cyst video of removing a simple epidermoid cyst, and in a couple of days, it'll get 100,000 views. I can put up a video on, how to beat diabetes, and it might get 700. I mean, people just aren't interested in what really is more important. Yeah. So the fact that you guys are here, I think, is fantastic.
Yeah, it is absolutely fantastic. I'm just so grateful to you that you're here and that you have a little bee in your bonnets about getting healthier, because you're going to feel better. Really, it's just going to be amazing. You guys, you just literally won't know how. You really will see a dramatic change. I've got Sharon is asking, how do I fast if I have 24/7 migraines and get bad migraines if I don't eat?
Well, I think that's really a problem. How do you treat your migraines anyway?
Okay, can you stick that up, Sharon? I'm going to look for the answer that.
And let me say again, fasting is not for everyone. Not everyone can do it. I'm just saying, what we're saying is fasting is a fantastic way to get healthier. Some people can't do it. There are some people that shouldn't do it. If somebody that's having 24/7 migraines, first of all, is extremely unusual. I would question the diagnosis, number one. Number two, I would like to know what happens if you take a triptan. I've had lots of patients that come in to think they have migraines, and they don't. They just have severe headaches, and we've found some pretty serious medical problems like normal pressure hydrocephalus, for example, and brain tumors and all kinds of things. But daily migraines, that's a serious problem if they truly are migraines. I would refer a patient, if I had a patient that was having daily migraines and I was convinced they were truly migraine, I would get them into a headache specialist. I mean, these kind of conditions can sometimes take weeks or months to sort out. Sometimes they're allergy based, sometimes they're dietary based, sometimes it's something we're eating is causing the headache. Sometimes it's not a migraine at all. Sometimes it's a mixed headache. Sometimes it's a headache, one kind of headache that's triggering a second kind of headache. There's headaches is an entire field of medicine all by itself sometimes, and very complicated headaches are not easily answered just by, well, can I do this or can I do that? I get migraines every day. I need more information to be able to answer that.
Okie dokes. What about red beet sugar? I've never come across that. Have you come across that?
I think red beets are good. If you start processing it out into sugar, well, then it's no longer a whole food, and it doesn't really fit my parameter of what a whole food is. So, what's the hang up about needing a sweetener? Get some stevia and use it if you need a sweetener. Use some Splenda if you don't, if you want to use sucralose. I don't understand the hang up on it, and all. There's tons of different kinds of sweeteners. We have maple syrup in the refrigerator, and on days that I'm not fasting, the DW will make me thank you, darling. She'll make me a little coffee, and she puts a splash of almond milk and a little squirt of maple syrup in it. It's all natural, but it's a sugar. Let's be honest, it's still a sugar. But our bodies are designed to handle sugars in the right amounts. There's nothing wrong with it.
It's the processed sugars that we want to get away from. It doesn't mean that you can't have anything sweet ever again.
No, there's not.
Sharon said she's been to Hopkins Hershey Medical Center. She's had her migraines for 10 years and she's been through all the tests.
Okay, so she has a very serious migraine problem. And the answer is yes, you can fast. And it's probably not going to improve or worsen your headache problem. And I'm sorry you've got an undiagnosed headache, or at least untreated without probably just pain medications. That's a horrible situation. You have my prayers. I mean, I think that's terrible. But if you've been through all of that and you've been told they are migraines and you've been told you're on daily migraines, I know there's some new medications that are coming out that are in, I believe, I can't remember if they're injectables or pills, but we do have some new medicines on the horizon to help with people that have frequent migraines. So I wish you the best.
Right, we are coming up for our 1 hour mark. Do you want to mention, is it your fourth benefit of fasting?
I've done 4, so let's review. We'll review the 4, and then I say we take a break. I've still got the Gonzo video, the Baby Gonzo video.
Yes,
so.
they're asking about that. We'll start the next session with the Baby Gonzo video.
Okay, so to review, the first 4 benefits of fasting, we talked about increased metabolic rate, lower blood pressure, lower triglycerides and cholesterol, and decreased symptoms of depression. So I'm going to stop here, and we'll be back on in just a few minutes so we can do a part 2.
Okay, so you just need to hang around on the channel and you'll see the live come back up. Okay, guys?
All right.
So thank you for watching the first half, my 50 lovelies, and I'll see you in 5.
All right.